Hello guys, welcome back to my YouTube channel. My name is Essa, now from Accra, Ghana, and on this channel I talk about health, faith, lifestyle and all that good stuff. Today I want to talk about cervical cerclage. I know it's been a long time, it's been a long time I've dropped the video, but I just decided to do this one quickly before I zoom off to it. Why cervical cerclage? I realized that there's not too much video about that, and a lot of women currently would have, you have a cerclage schedule, you're supposed to do a cerclage, and they wonder what exactly it is. Cervical cerclage is simply a stitch put at the cervix to prevent the pregnancy from being aborted. And aborted, I don't mean that you going to do the abortion. In medical field, whether miscarriage or you do it yourself, call all of them abortions. So to prevent the pregnancy from being miscarried, to make it simpler for you to understand. Now, there may be causes. Usually, if a woman has had a recurrent history of multiple miscarriages in the past, when she gets pregnant again, the obstetrician gynecologist and the team taking care of her would want to do a cerclage to prevent the possibility of it reoccurring. Also, some people have short cervix, so based on your scans, and when you come for routine checks and you do scans, and then the doctor, based on the scan reports, will be like, okay, no, your cervix is shorter than the required length, he or she may ask that you get a cervical cerclage done. So I would like to encourage our mothers. This is a quick video. If you've been asked to do a cervical cerclage, please, it's not the end of your pregnancy. It's not the fact that your body is failing you. It's because we do not want a repetition, or we don't want an occurrence of you losing your babies. And it's not just the previous, some of people, I didn't have a previous miscarriage, also probably I don't have a short cervix. Sometimes also multiple pregnancies because of the weight and the strain or the stress on the uterus. They may require some obstetrician gynecologists, based on their discretions, may want you to have a cervical cerclage done. And also sometimes for babies who are conceived through assisted reproduction, because of the stress it takes them to get there, just not to hear a story that you did an IVF, you did an IUI and you still lost the baby, they may just want to put a cervical cerclage just as extra padlock, because we do not want to take chances. Now, what are the do's and don'ts of getting a cervical cerclage? Usually when you are getting a cerclage done, typically going to be a day or two procedure. So depending on the time in which you lodge in the hospital, depending on the facilities available and the pressure in the hospital, you may be done quickly and go home by evening, or they may want you to sleep over so that they would monitor you. And this cerclage is usually done within the 12 to 14 weeks, early second trimester, or unless we have what they call emergency cerclage. So this one will be picked up late but may still be done before the 24 weeks to prevent the loss of pregnancy, or to prevent the eventuality that there's the expelling of the pregnancy, the baby can't survive outside the body or outside the mother's womb. You are likely going to be done under general anesthesia or spinal anesthesia, depending on how traumatic everything is happening. And it's a quick 15 to 20 to 30 minutes max procedure. The cervical cerclage is usually, unless the transabdominal one, but the cervical cerclage, when everything is okay, it's usually going to be removed by the 36th or 37th week to allow your body enter labor naturally, and then have for you to have your healthy babies. What are some of the don'ts? They include avoiding heavy lifting after a cervical cerclage until you are cleared by the doctor, and also after that they're still going to be pregnant, so heavy lifting and all those things are still not going to be advised during the pregnancy, because we want a non-stressful pregnancy. Also, you are going to be advised to avoid sexual intercourse for a period of weeks, usually 2 weeks and above, depending on the severity of your condition. Your doctor will tell you what you need to know. You are also do not miss your prenatal vitamins, because we need the pregnancy, the baby healthy. You don't go through all the stress, so you do not take your medications. Also, do not miss your antenatal appointment. Make sure you are present for every antenatal appointment, so we can check and make sure that the baby is growing, mother is fine, and everything is fine. I think I should bring me to the end of the video. So if you have been scheduled for cervical cerclage, if you know someone going to have this soon and you just want to encourage them and work this part with them, tell them it's nothing too serious. It's nothing, definitely not every procedure has its risk, so it's not like there's no risk, but it's over 98% a safe procedure. And baby is going to be fine, mother is going to be fine. It has no it's not, how will I say it, a stain on you not being able to carry your baby. Your body is doing fine. You are doing all that you can, and part of your body carrying the baby till term is ensuring that you get that cerclage, so baby will come out safely. Thanks for watching thus far. If you have any question, please drop it in the comment section. My social media handles are also going to be in the video and also in my description box. So if you want to get in touch with me, please do. And until next time, tada.